Hello, this is Dr. Mukhtar Yerima. Welcome back to this channel. Today, I'm going to talk about specific phobia. So, specific phobia is a type of anxiety disorder in which the individual who suffers from this type of anxiety disorder experiences the anxiety symptoms in the presence of some certain objects or situations, and these situations are different from what you find in social anxiety disorder, and they are also different from what you find in agoraphobia. So what are these kind of objects or situations that bring on specific phobia? These situations are classified or categorized into four categories. One of these categories is fear of some certain animals, which means the anxiety symptoms occur when the person finds himself in the presence or when he sees some particular animals. It could be animals like maybe dogs. Some people have a lot of anxiety when they see dogs. Some people experience anxiety in the presence of cockroaches. Others experience anxiety when they see spiders and all sorts of animals. It might appear inconceivable to you for anybody to be afraid of cockroaches, for instance. What would you be afraid of cockroaches for? For what reason, right? So it might look off for you, but this is the reality for some people who suffer from this kind of anxiety. Very innocent objects, animals, or situations can bring on their anxiety symptoms, and this anxiety is experienced as being severe, excessive, and disproportionate for the level of the threat that that animal or object poses. For instance, what threat does a cockroach, for instance, pose to an individual? Maybe for some spiders, like the giant widow spider, which we know can maybe be venomous, perhaps there might be some reason why you might be afraid of those ones. And even in the fear of spiders, the people do not even discriminate one type of spider from another. So they do not really care which spider are we talking about. Any type of spider can give them the anxiety symptoms. The second category of objects or situations that bring on anxiety in specific phobia is situations. So these situations include maybe flying. Some people cannot be able to fly, and if they fly, they experience very serious and severe anxiety. Other situations include maybe heights. This kind of people, when they find themselves at a very high place, maybe they cannot climb mountains, maybe they cannot go on a high rise building, maybe they cannot go to any places that are much higher than the ground or much higher than the so-called mean sea level or something. So these are some of the situations that can bring on anxiety in these categories of patients. Another category of condition or situations that bring on specific phobia is aspects of the natural environment. So for instance, thunderstorms. Some people would find themselves severely anxious and seriously afraid if they maybe experience a thunderstorm. That is an aspect of the natural environment, and these are natural things, but people who have these kind of situations experience a lot of terrible anxiety. Another category of situations that bring on anxiety in specific phobia is what we call blood, injury, or injection situations. So in these kinds of patients, the sight of blood would immediately trigger of the anxiety symptoms. So you can imagine these people will not want to be in the hospital. Or when somebody is injured or when they're injured and they see blood, that is the situation that brings on their anxiety. And this anxiety is disproportionate. Even if the blood maybe is not much, they begin to become very anxious. So, and therefore, those kind of people maybe might not be able to work as health workers. They cannot become doctors, nurses, lab attendants, lab scientists, people who deal with maybe bodily tissues, including blood, because these are situations that bring on anxiety for them. Again, in this same category, there are people who experience anxiety during injections or when they see injections. So, and in fact, allowing themselves to receive an injection is something of a tall order. They can battle it. They will not allow themselves to stand an injection. And you must have seen some videos of people who are battling when they are about to receive injection. And even if they are adults, maybe the thinking is that it's only children that should want to resist. But if you see an adult trying to resist an injection, that might maybe appear very hilarious, and people circulate those kind of videos and maybe make people laugh at them. But for this kind of people, it is a very serious situation. They experience a very terrible anxiety in those kinds of situations. So these are the situations or different categories of situations or objects that can bring on anxiety in people who have specific phobia. Now, when you mention that this person has specific phobia, you should follow it up immediately with the particular object or situation that bring on their anxiety. So maybe you say the person has specific phobia, and then you maybe put in parentheses fear of spiders, or you say the person has specific phobia, fear of injections. This is how to qualify the type of specific phobia that the individual has. In times past, there were some fancy names that were used, maybe arachnophobia, acrophobia, claustrophobia, which is fear of enclosed spaces, which is also a type of specific phobia, but it has been found that giving them those big or fancy names does not add any value. So even in clinical practice, you must not use those kind of big names. What is important is to identify that the person has this kind of fear or phobia and the person needs some form of medical attention. So what are the symptoms of specific phobia? Now, the symptoms of specific phobia, like I mentioned earlier, are exactly similar to the kind of symptoms that you find in other people who have other types of anxiety disorders. So the symptoms that are experienced in any of those fear situations include fear and apprehension, restlessness, worrying thoughts, palpitations, trembling, racing heart, sweating, dizziness, breathlessness, dry mouth, and a host of other anxiety symptoms that occur in any of the other anxiety disorders we've talked about. The difference is the stimulus or the phobic situations or the objects or the places or situations in which this anxiety tends to occur. There is, however, this observation that in patients with specific phobia, especially when the phobic stimulus is the blood injection injury type of situation, those individuals tend to also faint in addition to having the other anxiety symptoms. So this is a slight deviation from what you find in other types of anxiety disorders. So in patients with specific phobia, there is also anticipation, which is having anxiety symptoms when they are about to face a situation in which they could potentially go into their feared situation or where they are likely going to face their feared object. So you are going to fly and you have phobia for flying, or you're going to go on a high-rise building and you have phobia for heights, or any of those kind of situations. Before they even go there, they tend to begin to have the anxiety symptoms, and that is anticipatory anxiety, similar to what you find in other types of anxiety disorders. Additionally, there is an effort to avoid the anxiety provoking situation or object. Just like in other anxiety disorders, also in people who have specific phobia, they try as much as possible to avoid any such situations. So they try to avoid any situation that bring them in close proximity to that feared object or that feared situation or that feared circumstances. Now, the age of onset of specific phobia is usually much earlier than what you find in all the other types of anxiety disorders. Specific phobias usually tend to be the only anxiety disorder whose age of onset is in childhood. In fact, it tends to occur as early as 7 years of age, around the age of 7 or 8 years. So it is the anxiety disorder that has the earliest age of onset. It is also, like other types of anxiety disorders, about twice as likely to occur in women as in men. So in addition to having all the symptoms of this anxiety and having the anxiety symptoms in the presence of the specific anxiety provoking object or situation, the anxiety symptoms also tend to provoke distress in the person who suffers from this condition, and they also tend to result in disability. Specific phobias have actually been called simple phobias because these are phobias that do not occur all the time. So if you have fear of cockroaches, for instance, or fear of spiders, it's not all all the time that you come across spiders or cockroaches. Or if you have fear of heights, it's not all the time that you come across heights. Or if you have fear of flying, it's not all the time that you go to fly in an aircraft. So these are the reasons why they are called simple phobias, and these are also some of the reasons why it is not as debilitating as what may occur in social anxiety disorder or agoraphobia, because unlike in agoraphobia and social anxiety disorder, where you have to probably encounter one or more of any of the situations that bring on your anxiety, in specific phobia, it might take a while before you even come across anything that provokes your anxiety. So, what is the treatment of this condition? Specific phobias can be treated mainly by psychological interventions, and the important psychological intervention is called cognitive behavioral therapy. And the important component of the cognitive behavioral therapy that is found to be very effective is the behavioral component, in which the patient is exposed to the feared situation or the feared stimulus or the feared object. The principle of this cognitive behavioral therapy is that you have a fear of a certain object or a certain situation, and so for you to stop being afraid, or for you to stop this anxiety that you have for this situation, you have to be exposed to that fear situation. So it's just like this saying that you have to face your fears in order for you to stop fearing that situation, right? So essentially, that's what this treatment does. So it exposes you to the feared situation. Only that this exposure is going to be controlled, and it is going to be graded exposure, and it is also going to take place under the supervision of a therapist who is going to give you a lot of support and who is going to give you a lot of other components of the treatment that would make you feel relaxed despite being exposed to the situation that ordinarily gives you anxiety. So that kind of controlled, graded exposure to the feared situation is also called systematic desensitization. So systematic desensitization is one of the most important treatment methods in this CBT or cognitive behavioral therapy that is very effective and is about the gold standard of the treatment for specific phobia. So in addition to that, however, there are times when some medication might be used, maybe for a short period of time before this treatment takes effect. Additionally, other supportive forms of treatments are available that tend to help you to recover from this condition. So this is it for now. Thank you for listening. See you some other time.